Have concerns about whether you or your loved one is more susceptible to the disease. Joining us via Skype with more on this is Dr. Daniel Johnson, a medical oncologist at Ochsner Medical Center. Thank you for being with us.
Thanks so much for having me.
First of all, do some types of cancer treatments put patients more at risk for coronavirus?
We think so. The true answer is we don't know. There is data out of China in small numbers that patients with cancer or with a history of cancer have a higher risk of contracting coronavirus.
Okay.
There are some treatments like chemotherapy that do suppress the immune system, lower the white blood cell count, that would theoretically put you at higher risk for complications from a viral infection.
Sure, that makes sense. What precautions should cancer... I'm sorry, go ahead.
No, I was going to say there are other treatments. A lot of patients with cancer are not on chemotherapy, but other newer treatments like immunotherapy and targeted therapy. We really don't know what these treatments can do to a patient's immune system and how they would react to being infected and having COVID-19. Some concern is that one of the reactions to COVID-19 and what causes patients to have complications is inflammation in the lungs, something called ARDS. This can also be a complication from immunotherapy. So even though patients on immunotherapy might think this treatment is trying to stimulate my immune system to attack cancer, maybe it would attack the virus, we don't know whether that's the case or whether you would be at higher risk for complications because of inflammation in the lungs.
Wow. What about cancer patients in remission? Are they still high risk?
In general, cancer patients in remission would have the same immune system and have the same risk as the general population. So it's important that they follow all the same restrictions that we all are supposed to. But whether cancer patients in remission are at higher risk, we don't think so.
Okay, what about people who have just recently been diagnosed with cancer? Should they go ahead and start treatments now or kind of wait for us to flatten the curve throughout the United States?
That's something that they should discuss with their oncologist. Right now, we are continuing with cancer treatment. We have the ability to give our cancer treatments with minimal exposure of patients to healthcare workers and to other patients. We are doing a lot of telemedicine.
Sure.
Obviously, a lot of treatment of cancer can't wait. You know, patients are still being diagnosed with cancer during this crisis and they need treatment. We are delaying treatment in certain situations, chronic hematologic malignancies, some patients who have been stable for years on treatments.
Wow.
Some who have already had surgery and are getting adjuvant treatment for a while. So we are making decisions case by case, but in general, we are still open and treating as many patients as we can for their cancer and doing it safely, using a lot of telemedicine, making sure patients are wearing masks and protected when they get things like blood work and their treatments.
That's right. Ochsner's definitely been on top of this from day one. Thank you so much for your time. We really appreciate it. This is a large population, unfortunately, that have to deal with cancer. So this is great information. We appreciate it.
No problem. Thank you so much.
And guys, for more information, you can head over to ochsner.org/coronavirus.